If you are young, say 20 years or less, and for some reason you have developed slip disc in your lumbar spine, then what are the treatment options or surgical option for you? Normally, in young patients, a slip disc can be very well managed with conservative treatment. But in some situations, surgery becomes important. Normally, surgery is required in three conditions: if there is a severe pain radiating down the leg, or if there is numbness tingling in the leg, or if there is some muscle weakness. So, in such situations, we cannot just do a conventional surgery for young patients. Normally, whenever we do slip disc surgery or disc herniation surgery or lumbar disc prolapse surgery in a young patient, we use special technique and special precautions. We prefer a technique in which we do not damage the bone. We preserve the bone because it is important for strength. Similarly, we cut minimal muscles. We want to preserve the muscles so that in future the person can do all the activities. And thirdly and most importantly, we don't want to remove too much disc. We remove only the portion of the disc that is required. The portion or the fragment of the disc that is pressing onto the nerves, that is specifically targeted during the surgery, and we remove that portion only. So when we are doing a slip disc surgery for a young patient, we normally do an endoscopic or a microscopic procedure, but we take precautions not to damage the muscle, not to damage the bone, and not to remove too much disc. It is important because in future these young people, they'll be going for gym, sports, they'll be running around, climbing mountains. So in all such activities, it is important to have a strong and flexible spine. If we cut the bone during the surgery, then also it is a problem because the bone is there for strength. Secondly, if we damage too much muscle or we cut too much muscle during the surgery, then also some amount of pain remains and the flexibility and the strength goes down. Similarly, if we remove too much of disc, then also the load bearing capacity of the spine goes down. So in young patients, we normally do an endoscopic or a microscopic procedure without cutting any bone with muscle preserving technique, and we remove only the least amount of disc required for complete recovery. So if you are young, say less than 20 years, and you have been advised a disc surgery for herniated disc in the lumbar spine, don't worry, visit your doctor, and if your doctor is an expert and he is able to achieve all these three targets during your surgery, then your result will be good. Thank you.